Okay. Good evening, Stuttgart. Colonel Jason Condry, your Garrison commander, and I want to start by thanking you for joining tonight, taking the time to first of all put some questions in advance, and of course participate in this live stream event. Not unlike previous town halls, we've got quite a few experts participating virtually as well, hopefully answering questions that I may not get to, and in many cases clearing up some confusion that I may cause with some of my responses. I also appreciate quite a few of you in the community that, based upon other things that you've seen and places where we've tried to hang information, that you are answering questions that pop up based upon seeing that information. So that's helpful as well. I'll offer a quick COVID update and then jump right into questions, some of which have already been posted on with the notification. So first, it's been over 2 weeks since our last positive COVID within the community. So that's fantastic. It's quite a testament to all the members of this community. The things that we're doing day in and day out to continue to prevent the spread of the virus within our community. Of course, every day our medical team submits tests for members of our community that are experiencing symptoms. And each one of those tests is a concrete reminder that the virus is still out there. It's not gone away, and it's simply awaiting a misstep. It's awaiting somebody not washing their hands after they touch a doorknob. Somebody not putting on a mask when they're in a space that they can't guarantee 6 feet at least of physical distance from those that they work in and around or shop in and around. It's waiting for somebody to have forgotten that there's an invisible adversary out there waiting, looking for an opportunity, or being around people that are forgotten. So the easing of restrictions across Germany, I'm sure many of you have seen the articles, has resulted in an increase in COVID cases. It's probably not surprising. I'm hopeful that our community continues to remain the exception. Now, that's only possible with continued vigilance, continued effort on your part. So I'll use that good news and reason for caution to jump right into your questions, and hopefully getting most of them answered. The team has heard you in terms of tonight's format. I have minimized the opening monologue. I will try and find some more unique ways of saying I don't know, and I'll ensure that all those that are asking the questions either have a British accent or will attempt their best British accent in order to meet the desires of. So, first question, and Angelica, I appreciate questions with multiple parts. So this question is about quarantine. And so how long will a person arriving from the mainland be quarantined starting July 1st, 2020? So I will tell you that right now I don't know what June looks like, much less July as it relates to quarantine. The general standard for quarantine has been 14 days. And that's based upon feedback we received from the CDC, same kind of feedback that you see from the Robert Koch Institute here in Germany. So I anticipate that until conditions change, and change rather dramatically as it relates to the possibility of COVID being transmitted as people travel from one country to another, that we will continue to see some sort of quarantine in place, or at least a restriction of movement. We may call it something different. And I anticipate that it will be a 14-day requirement. Now, there are exceptions to that. We have people that will travel, official travel, and be gone for less than 5 days. If they are gone for less than 5 days and they return home, return to their place of duty, they will not be required to enter quarantine. That's the conditions today. There may be scientific evidence that causes that to change tomorrow. But right now, that's the standard we understand today. There are questions about whether people that PCS here have to go into quarantine. You can expect to go into some sort of quarantine. Stuttgart is unique in many ways. One of the things that most people know after being here only a short amount of time is that we don't have a lot of space. We rely on the host nation when we run out of room in our hotels, when we run out of housing on the installation. And so lots of questions about where quarantine will occur. How will we do that? What's the best way to do that? Who will support? And so I will tell you that right now, planning efforts are ongoing to answer those questions. We've had great cooperation with all the mission partners across the installation. We understand who is coming and approximate dates. We also understand who is leaving and approximate dates. We also recognize that those approximate dates are approximate and things will change. And so with our understanding of the requirements, and when we talk about lodging and when somebody's leaving a home, whether or not that home could be occupied rapidly, whether or not we could do the maintenance needed on that home as fast as possible so that a family that's coming in could go directly into their home. Those are all things that we're discussing right now, working through those procedures, making sure that we understand and anticipate, and in many cases now have a name and contact information and can reach out to a family and say, we know you're coming. Here are some potential options. Your sponsors in your units will be very critical when we're looking at what the inbound quarantine process will look like. We are working through in-processing, completely revamping it. I want if you are confined to a place and you have internet access, that you can work through the bulk of all in-processing requirements while you are doing your quarantine. Working with the team right now, we're putting together new products, finding ways to link families into those resources. Everything from doing your driver's testing to finding out, how to do to do the hospital orientation tour virtually. Those are all things, whether we're talking about the services that we offer, how to register your pet. Now, there are some things that you have to physically be able to do. We'll work through how to do paperwork, how to turn in paperwork, how to get things signed. But something as simple as going and getting a new ID card, you have to go into an office to do that. So there will be some things that as we look at the routine of in-processing, you will still have to do in person. And we will optimize, figure out the way to make sure that as much as possible, all of the upfront work is done so that when you show up, you are spending the least amount of time interacting with someone else. That protects you from potential spread of the virus. That protects that service provider from the spread of the virus. So we have 2 hotels. We're trying to figure out how we manage people leaving, how we manage people arriving. We're mindful of big families. We're mindful of pets. We're asking the questions so that we are making informed decisions. And so hope to have more information soon. I know that as you get closer to departure, as you send your household goods away, as you ship your vehicle, as you become more and more committed to the PCS process, whether you're arriving here or departing, the need to know increases with each and every day. And uncertainty is problematic. And I understand that. So we're going to continue to refine. You've relied on the app, the COVID button. For those of you that are going to be in and out, the PCS in-out button will be your next best friend. So I'm going to ask you to keep looking there as we adapt our process to the new environment we're finding ourselves in. That is where you'll see the changes. Okay. This question from Henny. When will churches open up again? So with the changes within the state of Baden-Württemberg, we were able to begin opening for services inside buildings and outdoor services. As I've talked to the religious support team here, talked to the chaplains, I've asked them to engage their congregations to see what the congregations want to do. For the most part, our virtual religious services, they have a larger participation rate than a lot of our in-person services. And as I look at our very small chapels and the number of people we will be able to put in our very small chapels, the concern from our chaplains is that when we go back into the Panzer Chapel or the Patch Chapel or over on RB, that we will cut those, the number of people that can attend, in half or worse, into fourths. And so right now, last weekend we tested, improved the concept of doing outdoor services. We did a proof of concept on how our Catholic parishioners will do communion. And so those processes are in place. Each one of those services has a COVID prevention and a mitigation strategy, and we'll do that for every one of those services. So when will they open up again? Technically, they're open up now, and with the right mitigation, we can do services inside of our chapels. I'm going to let the congregations and the chaplains gauge how we as a community do those services from this point forward. Ophelia, wanting to know about playgrounds opening. What are your guidelines for opening them? What scientific evidence is being used to justify keeping them closed? So, Ophelia, I guess I'll start by saying I have been one of the parents out supervising kids on the playground with my head down in my phone or talking to another parent, not watching what kids are doing, what my kids are doing. Occasionally picking my head up if I hear a scream or a cry that sounds like one of my kids. And so the authorization from the Germans right now is that 2 kids can come together on a playground. I can't imagine a process that we could successfully put in place and run that would not generate more conflict and more opportunity for mixing up of multiple kids and the potential for spread between families through their kids of this virus than opening up playgrounds. It is probably one of the highest risk events as I look at all the things we do on this installation. And so opening up playgrounds will be one of the areas where we very deliberately lag what's happening off post. Now, I recognize that with the revision of General Order 1 Bravo and what that looks like for whatever command you belong to, you can likely go off post and find a playground. And if you're following the rules and there's not more than 2 kids on that playground, may not be much of an issue. May not be much of a risk of a kid coming back and having contact, and getting the virus from a set of monkey bars or a swing or whatever the case may be. But the public order police are out patrolling playgrounds, and they are issuing fines to families that don't maintain the only 2 kids together on a playground. So we're not going to be able to have MPs patrol our playgrounds. I don't know that we can implement a system for our community playgrounds between our stairwell apartments that allows for some sort of equity, whether we're talking about sunshine, rain, amount of time. And so that, plus the risk associated with not being able to keep the equipment clean and still not having any science that says how long the virus remains on a piece of metal, on a piece of wood, on a piece of rubber, on any of the things that we find out in our playgrounds. Until that science is fairly conclusive and there are answers to those questions, we're going to be very deliberate about how we treat playgrounds and other common areas where our families get together. This question is from Awana. So I'm the owner of the Deutsche Kantine in Patch Barracks, and we've already opened for breakfast and lunch for takeaway only. I would like to ask that if on 18 May, you'll be allowed to put tables outside and inside in distance. Thank you. So, first of all, very good question. I know there's several people that are eager to get back to dining in, whether it's in an outdoor eating area or it's in inside one of our food courts, inside one of our canteens, and so this is one of those areas where, until it is authorized off the installation, and it's still not authorized. I know the 18th is when we're going to start looking at. We're going to very deliberately lag behind that. And so the first thing we will look at is how do we do dining outside. One of the measures that we have to implement is being able to track who dines, the names, the contact information, because we created the potential to have to trace where the virus was, who was there. And so there's, as restaurants open up and they take reservations, and there is a very deliberate process that if there is a staff member that gets sick, they can then go back and figure out who that staff member interacted with. And so that's a little bit different than our dining areas. For the most part, it is a counter pickup and go sit somewhere else. But again, back to the playground equipment question. We still don't know enough about the virus to know how long that virus, presuming the table was or was not wiped, and there's a chance that it may not be wiped, how long is that virus potentially present on the equipment? And what amount of risk does that constitute to the next person that sits down there? So again, not a great answer. We're going to pace off the host nation. We're going to look at opportunities to where we can start with outdoor dining first. And I know our APHES has taken a very deliberate look at what kind of additional mitigation measures we can put in place so that we can reopen food courts. We can put the tables and chairs back. They're going to be more spread out, without a doubt. Maybe plexiglass between individuals. It's not going to look like what it looked like several months ago. So I'm hopeful that we'll have some more information soon. So this question's from Robin. For those of us with direct family within Germany's borders, can we get an exception to the overnight stay restriction? So the first question that I would ask is, does the leadership of whatever organization you're associated with have an issue with it? General Order 1 Bravo was published by U.S. Army Europe, General Gerard. And then, of course, we worked very closely in coordination with AFRICOM and EUCOM leadership, who then published their own orders. And so there's language in there related to unofficial travel. And I'm sure that's what you're keyed in on. What I will tell you is that if you have a question such as that, I'd ask that you reach out and engage through the chain of command first. I don't want to be in a position where I am giving you information that is contrary to the intent behind the orders that you or the organization you are associated with have pending. So, Allie asked about kind of the next job, specifically going to schooling next. And if you're not able to get to schooling by the time classes start, you will operate in a distance learning type environment. And so in that situation, with the owning unit transferring to some sort of school detachment elsewhere, how do we work the logistical support? So, Allie, that's a fairly specific question, and I recognize there's a couple conditions that'll have to be met before we know all the details first. But as the individual on this installation that's responsible for supporting military families, service members, civilians, if the conditions didn't allow you to go and you need a place to live, then from my perspective, we'll work to make sure that the housing piece, the sofa piece, all of those things that are linked to staying in Germany as a member of the U.S. Armed Forces continue. There's lots of variables involved in that, and so I'd ask that as you see that about to happen, reach out, use the Garrison Assistance Team email, give us some specific information, and we'll work every one of those details one-on-one with you and your family. So, Raul asks, when do we expect the gyms to reopen? Raul, we're still pacing off the state of Baden-Württemberg. They have not opened up their gyms. They have not opened up their fitness studios. They haven't opened up indoor sporting venues yet. We saw them open up the golf courses, horseback riding, any sport where you can maintain 1.5 to 2 meters of physical distancing. There's no physical contact. We saw those open up. Of course, they didn't open up locker rooms, changing rooms, any of those things. They still didn't open up swimming pools. So any of those things that support that are not open. And so we can't even begin the conversation on opening the gyms until our partners have gone through the processes, identified what kind of mitigation that they are going to expect that we follow. And then, of course, from our perspective, we want to make sure that we do that right, exceed the standard in most cases, so that when we open up our gyms, it's without the risk that there may be otherwise. I think you can expect that wearing a mask is going to be part of your next gym experience. I think you can expect that you'll need to clean equipment before and after use. You may want to do that anyway. So there will be some new processes in place as we look to do that. I'll meet with the MWR team here in the next couple of days, and we'll discuss what the strategy is, still not knowing exactly what the requirements are going to be from our host nation partners. And then once we get that information, we'll adapt and we'll start telling the community what this is going to look like. Because I recognize that, fitness centers, they're here because we as a military community have a physical readiness requirement related to our mission. And so as quickly as I can get those open, we're going to find a way to do that. And so right now we can do outdoor fitness. Trying to figure out how we can do that in a, units are working through plans. Some have already figured it out. The concern is with equipment and how you keep equipment clean between individual users. And so that's a very detailed and rigorous process, and I know there's some plans out there to do that. I want to make sure that as I look at all of the different units, organizations, mission partners across the footprint, that what I can do for one headquarters when it comes to provision of equipment, I can do for all of them. And so I'm going to resist where I don't have the ability to support equally. Donna, your question was about the golf course. So the golf course is open, but the locker room is essential for those storing electric carts. When will the locker room be open? So fees are paid annually for these services, and I assume that in times like these, prorated fees will be applied for non-availability as well. So for the golf course, yes, it was great news. We were able to open the golf course almost immediately after the state of Baden-Württemberg opened their golf courses. The staff had been planning for that, and there's not a lot of mitigation that has to go in place, and it's pretty easy to keep some physical distancing out on the golf course. But the state didn't allow us to open up our locker rooms. So working with the MWR staff out there, they were going to find a way for people to go in and get their equipment, because we know that equipment is stored there in the locker room. But the locker room would not be open after that. And so the question about fees, great question. Please reach out to the staff out there, and we'll figure out how to prorate, the fees that accounts for the fact that you can't use part of the service that you're paying for. So Case asks, CYS status, please. So childcare. I know a lot of attention on childcare. We're quick to look back stateside. Here in Germany, child care centers and some kindergartens opened for mission essential personnel, and then about a week later began to expand. So there's some very detailed guidance that's come from the host nation, and we have received very detailed guidance from the Army as to how and what kind of measures we need to put in place before we resume providing child care. And as I'm looking at that and talking to the team, and we're planning for reopening facilities, it's to do it in a way that we, first of all, have mitigated the spread, because we know, depending on the age, many of the kids can't wear masks. Some of the physical distancing measures simply are going to be impossible. And so there's additional measures that we'll put in place, additional cleaning, additional controls. And so the staff has already started coming back in to begin to implement some of those measures, to do some cleaning and to do some specific training on what that will look like. And because there is that absence of distance between kids, and there is a requirement for contact between staff, and despite the amount of protective gear that our care providers will be wearing, they'll have a mask on all the time, there are some things that we will have to do. There will be some additional requirements for staffing. We won't be able to mix different age groups as we were able to do in some cases before. A lot of those things are changing. And so these are guidelines. We have to apply them to the facilities that we have. And for those of you that have used childcare here, there weren't enough facilities and there weren't enough care providers before. And so this is going to have an impact on how many kids that we can provide care for. So we've already We've already done some initial analysis as to how many kids we can support. We're going to put that information out to mission partners, bounce what we believe to be, mission critical based upon status, dual military, dual working families, single service members, all of those criteria that drove prioritization before. We're going to bounce that off the headquarters and make sure that our analysis makes sense with how they are organized for work. Because there's lots of different variables here, and we want to make sure that we've maximized the amount of care that we can provide. And so that question is ongoing. I don't have an opening date yet. I can tell you that we're working hard to make sure that we can do that as soon as it's possible, as soon as we have set the conditions, as soon as we can do that and have mitigated risk to our kids, to our care providers, to you as you bring your kids home from child care, as much as possible. So that again is just like playgrounds is an extremely high risk event, high risk area, and so the additional scrutiny and the deliberate lag behind procedures that are in place here as a host nation will continue to be in play. So Frank Cohen asks, when are the tennis courts reopening on patch? So I've already talked to the MWR team. We're trying to figure out how we can get those open as soon as possible, how we can control the access to them, what kind of COVID mitigation measures are going to be necessary. Again, tennis is one of those sports that you should be able to maintain physical distancing. And so we're going to find a way to get those courts open. As soon as we have more information, we'll put it out. Look at the Garrison Facebook page, look at the MWR Facebook page. As soon as we can, we're going to get some information out there to you. So this question, medical related, is antibody testing going to be made available on post, or should we seek it on the economy? Right now, I don't have a timeline for when we'll be able to do antibody testing. I don't know what kind of scale at which we'll be able to do it, or what kind of prioritization or directives we will be given related to who would get the test before others. So I know that's been part of the public discourse. Depending on which news source you read, different answers as to how we'll do that. We will soon have local testing here on the installation. It'll be focused on confirming or denying whether or not somebody that has symptoms, test positive for the virus, and it won't take 24 hours. Hopefully we'll be able to turn those tests in about an hour's worth of time. And so again, we'll work with our medical team over there at the clinic. As soon as we get the information and that's up and running, we will let the community know. This question is about ID cards from Sanja. So my question is about ID card extension, and it wasn't answered in the previous town hall or privately. So first of all, sorry about that. My son's ID card expired yesterday, and we've gotten conflicting information as to whether or not we need to get it. We can get it. Will you be able to get through a gate with an expired ID card? And so answer from my human resources team is that as long as your son is eligible, call us, schedule an appointment. We have some limited walk-ins, but we're trying to minimize the walk-in piece. So I'm asking you to call in advance, talk to the ID card office, and we'll make sure we've got the right documentation. You have it in hand, so you don't have to do a return trip, and we'll make sure that we get that new ID card for your son. So this question is about having one family in your home for visitation. And so it's my understanding that Baden-Württemberg has allowed, and Susan, this is your question, has allowed it for a while now. Angela Merkel is quoted to have said, 2 households will be able to meet and eat together under the easing of restrictions. There are numerous valid reasons this is favorable over meeting at public playgrounds, albeit with social distancing, with large portions of the general public. So please advise. So I know that's the question that many in the community have, is at what point can we begin meeting together? And so acknowledging that the chancellor put out information, she has also said that minister presidents of each of the German states will put out specific guidelines for that state. And so several pieces to this, and it's whether or not we're talking about this engagement between two families being an event. Is dinner an event? And we poured through the host nation, translated 24-page amendment to try and understand this as best as possible, and it's still challenging because from the perspective of many in the community, what's the difference between getting together for dinner versus getting together for a very small birthday party versus getting together for a promotion party or a retirement ceremony? And there is a very deliberate but slippery slope there. And so right now we have a limitation on events, public or private. We anticipate getting guidelines soon. There was some measures put in place just after Easter that allowed extended family to come together in one house. Not the same thing as having somebody over to your house for dinner. So we're working to get that information. We're working to make sure we understand that what we are doing is in line with our host nation guidelines. I am sure that there are families off the installation that are getting together, your neighbors, every day. I have no doubt that's happening. The intent behind these measures, again, is to minimize the spread of the virus. And with the easing, we've seen an increase in cases. And so I would ask, is the gathering necessary? I know that answer depends. It depends on the person. And so I will tell you that we've hung the new measures. We will continue to update them. As they publish them in German, it takes them several days to publish an English version. We do our best to translate those so that you can look at them and understand them. And even then, they appear to be written by doctors and attorneys, and it's tough to make heads or tails of some of the specific things. And so where you come up short, ask a question. If there is a piece of that is linked to an order that's been issued by the headquarters you're associated with, I would prefer that you go to your chain of command and ask the question. Again, I don't want to be in a position where I am authorizing something that a unit chain of command has not authorized. And I know that for the most part, every mission partner across this installation has issued orders that intend on us following the host nation guidelines. So I recognize that that's fairly cyclical. We've gone all the way around, around the question back to can I or can I not? The short answer is depends. Similar question. So Emily asked, with many of the German borders opening with some of the neighboring countries on 15th of June, will we as DoD personnel be allowed to travel to those countries as well? So first of all, there is a Department of Defense directive related to travel, both official and unofficial. And so you're going to France for shopping falls into that unofficial travel category. And Emily, I don't know if that's what you were asking about, but as an example, that would currently not be approved. I don't know when that Department of Defense guideline will change. So that's an instance where we have the host nation standard that is likely changing on a certain date, but we have a Department of Defense guideline. And so again, very fine line, comes back to that General Order 1 that has been issued by the organization you're associated with. And if there is a question, ask them. Within that language, for most of them that I've seen, there is a method to get exceptions, and there are going to be unique circumstances. And so if we can assist with identifying what some of those unique circumstances are and have that conversation and work through our liaisons, whether it's at the city, the county, the state level, and try and get an answer. But I will tell you that the Garrison assistance team that we have that wants to be responsive to your questions, it takes a little bit longer when we're working through the Ministry of the Interior or the Ministry of Health or whomever is the subject matter expert, depending on what kind of question that's being asked. So with respect to the opening of borders, there's the recognition by many nations across the EU that closing of borders shut off families from each other. It shut off a professional's ability to go across a bridge to work. And so there have been limited openings of border crossings. They are looking to expand that But up until this point, and up until they do expand that, there must be a legitimate reason to cross a border. And you're facing border guards from one nation in one direction, and another set of questions, and potentially another standard from border guards as you cross back into the other country. So there's some difficulties that have been encountered by people that find themselves in that circumstance. Again, until the DoD standard has changed, short answer is no. Once that changes, we're going to hopefully have enough information as to what's happening with the host nation, what's happening with the nations adjacent, so that we don't have individuals within our community that get caught on the wrong side of the answer, wrong side of the border. Okay. Here's a question from Ray. When can service members, DoD civilians, and their family members, okay, this one's linked to Germany's borders into the Benelux. So this is exactly the situation that I was just describing. Those border crossings, and every one of them is a little bit different, have the standards been established? So hopefully have more information soon to follow. I know we'll be able to provide some links to the EU website on the status of mobility and transport. But there are some concerns, and I know members, as I've read local press, there have been people that have a legitimate reason to move back and forth across borders that continue to have issues. Catherine asks, when will the passport office be open? This week, the passport office reopened to ensure that people that had already ordered passports that had come in got their passports. So, Catherine, there may be opportunities to begin filling out some of the paperwork that allow us to do things that generate, passport requirements, get, birth certificates, all those things. Right now, the Department of State has not resumed their operations. That's a concern that has been brought to the highest levels of Army and Department of Defense senior leaders, and they're engaging to try and address that and get those processes up and running again. And so I've asked the team to take a look at what can we do in advance of a receiving organization such as the consulate or the Department of State, so that when that process resumes, we very quickly can put those in and hopefully jump to the front of the line when it comes to having those products, having those passports, having those documents back to members of our community as quickly as possible. So this is a question from Quentin regarding the vet. Can I get into the vet sooner than the 22nd? I have an ETP approved. So, the vet clinic commander had mentioned that already addressed your question, Quentin. But I'll highlight the fact that right now, in terms of the operations of the vet clinic, we're focused on those families, prioritizing those families that need to do clinic actions that allow them to depart, allow them to PCS. Now, there may be opportunities to work with unique circumstances. So ask that anybody that has some of those situations, some of those circumstances, to reach out, contact the clinic, and the clinic will deal with each of those individually. This question is from Jennifer regarding return to work. So for some, work from home is ending next week, despite serious concerns about work environments being unfavorable to current social distancing and hygiene guidance. The work group in question alternates half stage in the office one week while half work from home. Despite group management's praise for high quality work production in this scenario, the military has determined all group members must be in the office concurrently. Would you speak to this situation and offer guidance to those who have safety concerns? So I've had this conversation with organizations across the footprint, and every organization is focused on bringing people back to work in a safe manner. I know we've got Public Health Command Europe officials that are going and looking at individual workspaces and say, hey, for this one, you may consider doing this, putting the kind of measures in place that allow an informed decision as to how we could bring people in. What additional modifications do we need to do? And there's a lot of things that go into that. Of course, we've got to make sure that we haven't affected airflow. We haven't, by putting up plexiglass everywhere, we haven't prevented the ability of our fire suppression systems from doing what they're designed to do. And so there's lots of elements of that. And what I have observed is that Organizations are very deliberate about that process. And so if you have some concerns, I'd ask that you reach out to your supervisor, reach out to the leadership of your organization and say, hey, here's what I'm concerned about, and have that conversation. What I've observed thus far and the engagement I've seen with the medical professionals is they're focused on opening up in a way that they don't have to then close down that workspace because someone ends up being sick. So have that conversation. If you've got some concerns, let me know. We'll see if we can work some of those things individually. So this question is about red, white, and blue. So I'm on the red team, but in isolation. Can I have somebody shop for me? I'll miss my window, and I need to get groceries. So 2 answers to this. First of all, we've implemented, a volunteer shopping program. So you go to that volunteer button, and we've got Charlene that'll link you up with someone that's willing to get something specifically for you. We have lots of people across this community that says, hey, I raise my hand. I will be willing to go shop. I'll be there when the cashier calls you, Lewis, and has you pay for it, and then I will bring it to you. We've got some incredible people across the community that will do just that. Kind of leads into the next question. So told you at the beginning of the update that the community has been successful. And so as a result, we're going to make some adjustments to the red, white, and blue concept. And so there's a couple different pieces to that. We've got to make sure that we've done the right notifications to the different works councils and to the staff, and make sure that we've got schedules set. But starting the 21st, so into the next red, white, and blue cycle, actually, if you're white group like me, the day that you start, you will have additional members of the community that are able to use the commissary, use the PX main exchange, starting that day. So on the 21st, we will take the commissaries and the main exchange out of the red, white, and blue program. So there will be some return to previous opening days, and there will be some differences in hours. I'll tell you that right now. But as we're able to, those facilities will come back up to previous staffing, previous hours, and presuming we don't have any setbacks, no spike in infection within our community, we will keep those services outside of red, white, and blue. And so, Lewis, as you come out of isolation, the good news is you might be able to go and do your own shopping. So, some additional pieces to that. I know that red, white, and blue created the opportunity for 2 of our communities to have access to their commissaries on the weekends. If you lived on Kelly, you lived on Panzer, neither of those commissaries were open on the weekends. So starting on the 21st, those 2 commissaries will move to a new opening day schedule that has Saturdays open. So commissary will be open Tuesday, Wednesday, Thursday, Friday, Saturday. It will close Sunday, it will close Monday, and then reopen the next Tuesday. So that is starting on the 21st. The food courts, I know there were questions about why can't we have both places that deliver open on alternating times. So we will bring all food vendors, presuming that they are able to staff, back into the Panzer, back into the Patch food court, starting the 21st. And so the hours, again, we will gauge hours based upon our ability to staff. And we've got the general manager of AAFES here working closely with his team to make sure that's done right and done in the best way possible. And so some changes to the main exchange, the food courts, the commissaries, those are going to come out. A lot of you are saying, well, what about the mail rooms? So mail rooms are still fairly problematic. Those of you that have seen behind the counters in the mail rooms, you know how small they are. We still have some staffing challenges. And so those are going to remain in the red, white, and blue construct for the time being. We'll look at ways we might be able to mitigate that. And I know for some units they've been part of the program, the pilot program, where they pull mail out and receive their packaged mail through mail handlers. And so that will continue. regardless of what we do with red, white, and blue. But for the time being, our community mail rooms where you go to get your packages will still remain in the red, white, and blue schedule. So continue to use the app. Continue to look to see, when you can go and pick up your mail. Okay, this question is from Bridget. When will school end? So, received a brief from the superintendent and the team today about how schools will do their end of year procedures, how you'll turn in instruments, computers, books, go clean out lockers. And I know some of the schools have already begun that communication with parents and with members of the, with students as to how that process is going to happen. The Dodea Europe superintendent, Dr. McMullen, just announced that the last day of school is the 9th of June. That's the latest that school will be open. Each grade and each class, there's the potential that classes and grades and all of those things will be done a bit earlier. And so the process you should be hearing about from school leadership here over the next couple days as they roll out exactly how you will come out to schools, turn in equipment, get ready for those end-of-year procedures. Okay, I think I've worked through all the questions we had in advance. Anybody with an attempt at a British accent?
Yeah, sir, based on your guidance, we brought in a secondary British person, so here we go.
Hi, sir. Paul's not here tonight, but I will be asking the questions in line with your British accent guidance. John is first, presumably an active member of the community. He'd like to know when private organisations will be able to meet again.
So, John, that question kind of comes back to what is considered an event. What is considered a public gathering, a private gathering? Is there a way to do that inside versus outside? What kind of mitigation would need to be in place for those kind of meetings? And so I don't have a date yet. And I anticipate with the next amendment that comes out from the state of Baden-Württemberg that will have more detail, because I know, whether you're talking about scouting, whether you're talking about, spouses club, whether you're talking about one of the many organizations we have across the installation, the ability to do something, more than just virtually is what everyone's eager to get back into. And so I hope to have more information soon. What I can tell you is that you should anticipate that there will be, guidance that comes out, sort of a COVID mitigation plan for every one of those events, meetings, gatherings, and part of that is because, we anticipate having a requirement to be able to provide those in attendance. And so if there is some sort of, positive case, that we can link back those individuals to who they had contact with. And so those are the things that we are anticipating, and based upon our initial conversations with officials, government officials, we think those things will be announced fairly soon. So more to follow, John.
Sir, we couldn't just have a British accent, so we have someone else here to ask the next question.
Buonasera, Colonel Conry. Michael asks, when will duty buses return to normal schedule, specific in the AM?
So, good question. I've asked because understanding that organization across the installation are bringing more people back into work. I've asked our LRC team to take a look at how many people are riding buses, because at some point, we are having problems keeping people physically distanced on buses. And so deliberately looking at that, if you're seeing something that we're not, let me know. Whether it's a nice comment, whether it's an email to the Garrison assistance team, if there's a specific route that is a concern, and you and 20 others are standing at the bus stop and some people aren't able to get on, we want to make sure that the duty bus does what it's intended to do, allow people to get to their place of work. And so if you're seeing things out there that we're missing, please ask the question. Let us know. I don't have a hard date yet. I'm letting the demand, the ridership statistics drive what exactly it is. And I recognize that as some units are doing week on, week off, that may vary from week to week. And so there's several of those variables out there, and so we're trying to gather the right information so that we can make an informed decision.
So we've got a question from Cindy. Any news on summer camps or sports for kids?
Cindy, that's a good question. I have asked our child and youth sports and our community rec division to take a hard look at that in anticipation that I think we will get permission to do those things soon. I know that across Germany you've got professional sports teams, Bundesliga, that have already talked about ghost games and begun training. And while very few of our kids are that caliber of athlete, I recognize that we have a lot of families that are going to depend upon those type of programs over the summer to defeat the cabin fever, especially if we don't anticipate having the ability to travel like many of us plan to do this summer. So I'm hopeful to have more information soon. We want to make sure that we put those programs together with the right mitigation, and if that means we have to offer more, find a way to offer more. We want to try and gauge the community's demand. Of course, we don't have lots of green space to lots of soccer fields, but we're going to try and work around that as much as possible so that we can do those camps, do those physical activities, do those things that our kids were looking forward to, that they enjoyed last summer. We're hopefully going to find a way to do those very soon again this year.
Signore, Sanya asks, how quickly would you go back to restrictions if cases go up? How bad would it have to get before going back to strict measures?
So strict measures, and of course, if you've been reading the translations of the German newspapers that the public affairs team has been putting together, you may have heard about what is called the emergency brake concept. And so I highlighted it last week during the town hall, but it's focused on infection rate, and Germans are looking at it, and specifically in Baden-Württemberg, looking at it by county by county. And so if there is an increase of 50 infections per 100,000 citizens in a 7-day window, then you're supposed to implement restrictions. Now, there's no specific guidelines as to what kind of restrictions need to be implemented. And to give you some context as to what that number means for our community, when you look at 28,000 approximate members of our community, in a 7-day period, if we had 14 new cases, we would be required under the current state ordinance to implement the emergency brake. And so it's because of that requirement that you will see us continue to maintain some form of red, white, and blue. I don't know if we would need to go back to what we saw, as many as 4 weeks ago. I don't know how we would need to mitigate work schedules, how we would need to implement additional screening. There may be a menu of things that we would do. And the short answer is it depends. It would depend on how we traced, where we traced the source of the infection to, if we were able to trace the source of the infection. Because there was a time there where we saw spread within the community and had difficulty tracing where it is. So as you see us implement some of these easing measures, we're implementing them with additional measures in place, such as if you go get a haircut, we know who you are, we have a contact phone number, so that if there's an issue, we can trace. And so a lot of those same trends you'll see present in each one of the things that we do. If there is an event, a ceremony of some sort, there will be a mitigation measure that allows you to, a plan and of course a list of participants so that we can trace.
So we're running a little bit late. We're down to our last question of the evening, back to our British guest.
Sir, I think having attempted the British, I think I'll just end with some authenticity.
Thank you.
Angie would like to know, will we be allowed to mark routes on all bases to give people an option for a Memorial Day run or walk?
So, Angie, that's a good question. Let me see what we can do. I'll ask the team, and if that's something that the community wants to do, we'll see if we can find some way to do a virtual run. Obviously, we're not going to be able to do, everybody together, kind of the start line, watch the gun go off. But if there's a desire to do that, we'll see what we can do and put out there. So I appreciate I appreciate your question. I appreciate the questions of everybody, both before and during the event. Some great questions. I know, and of course I'm not seeing it, but if the trend has continued, lots of experts out there answering your questions, lots of members of the community that know the answers in some cases better than I, will provide feedback, especially for those that have joined late, saying, hey, you answered this 10 minutes ago. And thanks for your patience as I don't have clean answers to a lot of these things. I have questions that I have asked and have not received answers to, and don't always do a good job of explaining what's going on and kind of the why behind it. We continue to update the app. Go to the COVID button. Look at the COVID regs button. The most current information that we get as to what's happening in the host nation, we will put it there. It may be a translation from a press conference. It may be the most current English version PDF, 24 pages long, that's published by the state, and of course, several days after you really wanted the information. But understand that there is still some variance in how that may apply to you. And so if you've got questions, ask your leadership. There's a mechanism to get exceptions. Ask us. We'll try and find out, what is the specific guidance out there from our partners at the state and in some cases local levels. And so, we've had some good news as a community lately. None of it prevents us from having to wash our hands, having to wear a mask. So continue to wash your hands, continue to mask up, continue to keep 6 feet of distance between you and those that aren't members of your household. So good news today, some good actions by our community. We're gonna continue to adjust how we operate within this COVID environment. But that being said, it's still COVID day. So be vigilant, stay healthy. Have a great night. Thanks for being here.